Jim Blue with Kerry Maffio here, talking again about the virus, the vaccination, the vaccines that are available. Talked about the nasal vaccine, which is available now in Indiana, but soon we will be getting the injectable one as well.
That is correct.
Tell me about that and who gets it.
That vaccine is the one that is traditionally injected into the muscle in the arm. It is anyone who's 6 months of age or older can receive this vaccine. So, and also if you are pregnant, this is the type of vaccine that you will be receiving.
Mrs. Allen, whom we saw there, is pregnant. And there you have a little graphic on the screen there where it talks about the inactivated vaccine being in the flu shot.
Yes.
It's the weakened vaccine that is in the nasal version.
So there is the difference. The nasal one is a weakened live version, where the injectable is an inactivated one that has particles of the virus that actually stimulates the body's immune system to fight against the virus.
All right, let's talk about the fact that some of these are the thimerosal-free vaccine. Thimerosal is a preservative that is included in some kinds of vaccines.
Yes.
Does it apply in this case?
Yes. The nasal vaccines are thimerosal-free. And what thimerosal is, it is a mercury-based preservative that we add to the vials of the vaccine to prevent it from becoming contaminated from bacteria or fungus.
Right.
And it's to protect patients to get any sort of infection or contamination. Now, thimerosal-free is in the nasal vaccine, or I'm sorry, thimerosal is not in the nasal vaccine, but there are some thimerosal-free injectable vaccines that are what we call single-dose vials. So those are available in the injectable form as well.
And the reason there is some concern about this is?
Well, there has been a very comprehensive review of information about thimerosal, and some people have concerns on its safety. It is a type of mercury-based. However, lots of studies have been done and lots of investigation of that, so some people have had concerns about the safety of thimerosal, but currently right now, we cannot have any conclusive information to say that there are concerns with it.
The point being that if you were concerned about it, there are vaccines that do not have it. Okay,
yes,
so you may want to ask your doctor, whoever's delivering the vaccine, about that.
Yes.
How were these vaccines rated for safety? I mean, they were moved to market or to delivery very quickly.
It's actually interesting. The overall process takes about 5 to 6 months to produce an influenza vaccine. And this is the same for the seasonal influenza vaccine and as well as the H1N1 vaccine. And so a lot of people have addressed that of this has been very quickly. Now, one thing that we can look at is that the same process and the same manufacturers are being used just like we do for the seasonal vaccine. Every year the seasonal vaccine changes, so the components of that are changed. So just like the H1N1 virus or vaccine, that same process and the same manufacturer. So it's kind of like if the flavor has changed, so to speak, but the process in making that product is the same. So
people should not be concerned that just because this came online so quickly, they should not be concerned because you're using the same methods that were used in the seasonal flu.
Yes, and they are still studying it in clinical scientific studies, just like other seasonal vaccines or influenza vaccines as well.
Let's talk about back in the 70s. I can remember, I may be one of the few who can here, about the last time we talked about swine flu, people got a vaccine for that.
Yes.
And then there was, after that, there were some cases of what was called Guillain-Barré syndrome, and some people thought the two were connected.
Yes.
Were they?
They did do a review, and what they found was that Guillain-Barré, which is a condition where your body attacks its own nerve system, and what they did was they found that in 1976, when that did occur, there was a slight increase of GBS or Guillain-Barré syndrome for people who did receive that vaccine. However, when you look at all of the information now that we have available for influenza vaccines, that increased risk is very small.
Okay, so we'll leave it there. Thanks very much, Kerry Maffio, for answering our questions at this point. And let's go back over to Eric from Indiana's News Center. Eric?
All right, thanks a lot, Jim. We're speaking with Dr. Scott Mann, who is medical director of both the Three Rivers Ambulance Authority and Emergency Services at DuPont Hospital, and he's here on behalf of Lutheran Health. Dr. Mann, I get sick. I suspect it's H1N1 flu. What do I do?
If you're otherwise healthy, that's a great question. We'd like you to stay home so you're not infecting anybody else.
Stay home?
Yes, for the most part. And we'd like you to stay home until your fever goes away at least 24 hours.
Without aspirin, without anything else that artificially brings down your fever?
That's correct.
Who are the high-risk groups for this particular virus?
Yeah, the high-risk groups are groups that would have an increased severity of the disease, and these would include pregnant women, ages 65 years of age or older, in 5 years of age or younger, especially 2 years of age, they have a little more problem than in 5 years of age children. Those with chronic diseases such as heart disease, diabetes, kidney, liver problems, immune depressive or immune response decrease such as AIDS or HIV, and respiratory problems such as COPD or asthma.
When should a person call the doctor? I mean, you're sort of on your own. You have to make those decisions yourself as an individual. There's no one there to tell you to go call the doctor. On what do you base that decision as a individual?
Well, that's a great question. I think if you have mild flu-like symptoms and you're not a high-risk category, you could stay at home until, again, your fever leaves for at least 24 hours. If you have a high-risk category in those groups we just mentioned, you should call your doctor for further follow-up to see if you need to be treated or seen.
We have some graphics that discuss the signs and symptoms. Maybe we can put those up and you can review with us the symptoms of H1N1. And do we have those graphics?
Sure.
There we go.
If you have the following symptoms, you most likely have flu, and this would include fever, sore throat, body aches, headache, fatigue, sometimes diarrhea and or vomiting, cough, runny nose, or chills.
Anything, what in particular are young people specifically subject to in terms of these symptoms? Are there any symptoms that are worse than others in young people as opposed to older people?
Well, the most common symptoms we're seeing are fever associated with either a sore throat and or a cough. Now, if you get some what we call emergency warning symptoms, we want you to go to the emergency department, and this would include trouble breathing or breathing fast, persistent vomiting, decreased fluid intake such as dehydration, or if you have a change in mental status, that is, let's say you become too sleepy, you can't be woken up, or you become agitated, or just not acting right.
How about, we've seen some people wearing masks. Is that a good preventative measure?
Well, it gets back to standard precaution. We like you, again, as was emphasized earlier in this program, I'm sure tonight, was to make sure you wash your hands, and that if you cough into a tissue and throw that away. But masks would help prevent respiratory droplets from being transmitted, so it would help to do that, yes.
In emergency rooms, how are they going to handle these patients? Are they going to be segregated from the other patients in the emergency room? Are they supposed to come into different entrances? Are doctors going to be handling them differently?
Great question. I think every hospital in the community here has prepared for this and have had meetings and decisions on what to do, but we want to try to maybe separate them from other patients in the waiting room as well as in the emergency room proper, so that we're not spreading the infection between patients.
We only have about 20 seconds left. Is there a danger if this is a successful effort and this flu does not get out of hand, are people going to then become, less concerned when they should be concerned in future years?
That's a great question. I mean, we saw this with the avian or bird flu, and we fortunately didn't have a pandemic with that, so that is a concern, but I think because we're having this meeting tonight and educating the public, that shows you how concerned we are here at the local level.
Very good. All right, Dr. Mann, thanks very much.
Thank you.
I think Bruce is at the phone bank with some information for us. Bruce?